as human beings, we are hurt within relationships, but we will also repair within relationships. And it's the nature of the relationship that helps that repair. So the psychodynamic psychotherapy, the therapy relationship, is different from the relationships that they've experienced in the past. And that's what over time leads to the behavioral change. So what is the basis of psychodynamic psychotherapy? The basis is that all of us in childhood have innate needs, every single one of us. And the main task of mental psychological development is to learn how to meet these needs. But when we talk about learning in childhood, remember the prefrontal cortex is developing. So most of the learning happens through what's known as reward prediction errors, which is the basis of learning. The dopamine plays a crucial role here, which means that prediction and outcome, the first time a child tasted a lollipop, right? It's sweet, a pleasurable feeling. The next prediction, outcome, the next time the expectation is that when they lick a lollipop, it's likely to be sweet. But imagine when these prediction and outcomes that we are used to saying, when I call my dad, or if I'm crying, that someone comes and soothes me, prediction outcome, it's consolidated. When children grow up in an environment where that is inconsistent, when trauma's present, when losses have occurred, acts of commission, omission, uncertainty because of a range of reasons, not necessarily intentionally always, is that these prediction errors, reward prediction errors, the minimization of it doesn't occur. These are surprise signals that need to be reduced so that we don't constantly live with surprises, because all surprises aren't necessarily positive. So this learning how to meet is unconscious. That's the unconscious that we talk about. It's embedded in the striatum. These are automatized predictions. So children within traumatic environments have developed ways of self-soothing, ways of interacting with the world that are embedded. Now the thing is, it served them well in childhood within that environment. Those same patterns, characteristics, thoughts, emotions, behaviors may not serve them well moving forward in adulthood as they have to interact with other individuals. That's really the basis of what we're talking about as psychodynamic psychotherapy. Because you see, these methods, so the main task and what are the methods that we use in psychodynamic psychotherapy is we know that these patterns of behavior are executed unconsciously. They've moved into the habit area of our brain. So therefore, in order to change it, we need to they need to be returned to the consciousness in order to change them. And that's the basis of psychodynamic psychotherapy.